Good afternoon, guys. I hope we're all sparkly. I've just returned from the gym and I'm about to eat. I've earned my reward. I'm feeling pretty good at the moment. Why is that? Is it because I consistently look to improve my health? What a weird thought, having to think about health when most animals just get on with it. Well, we've said it before and we'll say it again. We are physical beings in a world full of psychological stress, and we release the same neurotransmitters and hormones with psychological stress as we do with physical, but we're physical. So remember, if you've had a stressful day at work and you've not got a manual job, do some exercise and you will surprise yourself. You're not tired yet. But activity, food, rest, sleep, repeat. Day, night, day, night, day, night. Your body doesn't care about your emotions, the working week, blah, blah, blah. So, why am I feeling pretty good? Yeah, I'm putting the work in. I finally learned that I can't burn the candle at both ends. I need to train hard and rest well. I need to reduce my stress levels. I need to sleep. I need to eat properly, and I need to train. I do occasionally indulge because I'm only human and I'm flawed, like all of us, but I'm always trying to be better. So it is all about perspective. And when you've got low testosterone, your perspective is distorted. You've got low mood, an element of anxiety or depersonalization. You're tired all the time. Your libido's low. The weight of the world really is on your shoulders. Now, life is tough and you have to crack on. You choose to be glass half full, not glass half empty. But with low testosterone, everything's fighting against you. So, you're glass half empty. You put the work in, you don't see the reward. What's the point? What is the point? Don't know. Because in reality, we're all seeking reward. Now, you may well have taken the path of least resistance, maximum reward, short-term gain, long-term loss, like a lot of us, indulged in naughty behaviours. You've taken your reward, not earned your reward, and you've paid the price. Shit happens. Get on with it. Nobody cares. Work harder. So you jump on testosterone replacement therapy, the cure. It's not the cure. Disappointingly, it's not a quick fix. It is the foundation. Again, as we've said many times before. So you jump on testosterone and you immediately feel great. What is that? Well, that's a drug effect. You've had low testosterone and you've artificially raised your testosterone and subsequently dopamine, the reward chemical, and you feel great. Let's continue increasing the dose to increase dopamine even further and feel amazing all the time. Obviously, the life that we lead necessitates balance, but it necessitates contrast. It's yin yang. So that first little boost that you sometimes get is artificial. Now, sometimes that can be negative. And again, chill. You've got to trust the process. We've got to get your levels stable, because testosterone, as I've said before, is not a feel-good hormone. It is a hormone that hopefully gives you some drive and determination and motivation to go and earn your reward. So we have this natural spike in the morning with this rise in testosterone and rise in dopamine to almost signal us to get off our asses and do some work. If we felt great, we wouldn't do anything. So again, think about testosterone as a catalyst for you to put the work in. So this drug effect that we have, obviously pharmacokinetics and pharmacodynamics are involved in this, and we are trying to achieve stable male androgen levels for long-term physical and psychological well-being. But I want to feel good. How do you feel on testosterone? Well, once you've got optimal levels, you feel normal. What the hell is normal? Well, that's for you to decide and for you to take action on, because this is your journey, not mine. So, see the glass as half full. Perspective. So your perspective has been distorted. Your perspective needs to change. You don't need to dwell on the past. You need to be considered in the present. And we've said before, testosterone is a calming hormone. And with low testosterone, lots of people complain of irritability. And that's because you've got the stimulatory neurotransmitters, the excitatory neurotransmitters, and catabolic hormone, cortisol, firing to keep you alive, but not considered. It's sensing danger. But you haven't got the counterbalance of testosterone, your parasympathetic nervous system, the calming part of your autonomic nervous system, and your brain to work for you and not against you. So think of testosterone as a calming hormone. The whole roid rage thing is absurd. But you can be a bit of an arsehole with testosterone if your levels are way too high, because you are not balanced and you are not considered. We want you to be cool, calm, and considered in all situations. Have a proportional response to a situation, not an exaggerated response. So that seesaw of these excitatory neurotransmitters and cortisol compared to testosterone and your parasympathetic nervous system needs to be in balance. So we're not seeking a drug effect. So are we seeking true stability? Well, yes and no, because obviously the premise behind any therapy should be to mimic natural physiology or resolve a problem so that natural physiology can ensue and you can feel how you're supposed to feel. So that's the whole point. Testosterone reaches a stable level. You need to titrate the dose according to effect to get you where you need to be. You need to manage estradiol. Now that should be simply through being healthy, through monitoring your weight, not putting crap in your body to stress your liver. Because the two organs that the aromatase enzyme is in that you can directly impact how much testosterone gets converted to estradiol are body fat and liver health. So, as my mum says, be your own best friend. Be your own best friend every day. Don't dwell on the past. Let's crack on and earn our reward. So, daily microdosing of testosterone, cypionate, and HCG. That is gold standard TRT. That's what you should be on. Now, that's not to say I don't have patients on other substances. Some of them are on testosterone and ananthate because that gets prescribed by the GP. Some of them are on weekly doses of Nebido. This is typically for the low SHBG guys who can't get stable with test-cyp or an ananthate. That's very rare. HCG. Most of my patients are on HCG because this mimics luteinizing hormone. So we subscribe to HRT, not TRT. We want to normalize as many chemicals in your body as possible. So this daily dose of testosterone and HCG. We've talked about getting stable levels, and that's the goal of TRT, to normalize your levels. But again, life isn't stable. We have the natural rhythms of life. So the daily injection of test-cyp and HCG, by the very nature of injecting a substance in the morning, because testosterone peaks in the morning, is going to cause a subtle peak, which again is mimicking as close as, damn it, physiology. Isn't it fascinating? Stable levels, but again, the premise behind therapy is to mimic physiology. For you to allow you to go and do what? Yeah. One more time. Earn your reward. We have a relationship between testosterone and dopamine. We have a relationship between estradiol and serotonin. And we want to use our hormones appropriately. We don't want to overreact. We want to apply a level of chronicity to a situation to allow our brains and autonomic nervous system a fighting chance of reacting appropriately to situations, not having a drug effect. Drug effects are probably what's got you in here in the first place. All right. It's a bit hot now, so I'm going to go. All right. Have a good day, guys.